In today's class, we'll discuss about one of the drugs which are related to the central nervous system, that is hypnotics. So what are hypnotics? Classification of hypnotics and the pharmacology of the drugs will be discussed. Before going into the actual topic, let us see what is sleep. So sleep is that we have different stages of sleep. So here in the normal sleep, it consists of different stages and it is based on the three physiological changes. So there are different stages in the sleep, and in these stages are depending upon the physiological stage. So what are those? One is encephalogram, an electromyogram, and electronystagmogram. So what are these? So electroencephalogram. So electroencephalogram is or as we can say, it is a graph, or it is a form where the electric activity of the brain can be explained, or else the electric activity of the brain can be projected. And if we see electromyogram, it is a graph where the electrical activity of the muscle can be predicted. And electronystagmogram is the electrical activity, or we can say the movement, rapid eye movement can be observed by this graph. Here in sleep, we have two types of sleep, that is rapid eye movement sleep and non-rapid eye movement sleep. So rapid eye movement sleep constitutes about 25 to 30% of the sleep, whereas non-rapid eye movement will constitute to 70 to 75% of the sleep. So in non-rapid eye movement sleep, there are 4 stages. So stage 1, 2 as well as 3 and 4. So if we see in stage 3 and 4, that is a type of sleep where there will be slow wave. In the sense, the sleep will be altered. So most of the sleep is categorized under non-rapid eye movement sleep. Let us see the different stages of the sleep. So in stage 1 is constituting about 4 to 5%, and the sleep will be light. In the sense, the person is just slept. In the sense, the sleep is not completely yet came. So there will be light sleep, and muscle activity will be slowed down. The muscles will be getting relaxed, and occasional muscle twitching. So not regularly, on occasional basis there will be muscle twitching. And second stage is constituting about 45 to 55%, where the heart rate and breathing pattern will be slowed down. So while we sleep, the heart rate as well as the breathing pattern will be slowed when compared to the normal one, and slight decrease in the body temperature. And if we say stage 3, it constitutes about 4 to 6%, and where the deep sleep just begins. So the person is not into deep sleep yet, the deep sleep just begins, and the brain begins to generate slow delta waves. So there are the waves which are generated by brain are of alpha, beta, delta and gamma. So the delta waves are generated by the brain in this stage 3. And if we see stage 4, 12 to 55% of the total sleep, and the person will be in very deep sleep. So this is up to, we can say this is up to half an hour. So this stage 4 sleep will be for about half an hour in every individual. And the rhythmatic breathing. So here the breathing will be in a rhythmatic way, and even the heart rate will be also in a rhythmatic way, and the muscle activity will be only to limited. So neither there will be excessive contraction or relaxation. So the stable muscle activity can be observed. And here the brain produces delta waves. So if we see the difference between stage 3 and stage 4, the brain begins to generate delta waves, but in stage 4, the delta waves will be completely generated by the brain. And if we see stage 5, which is also called as rapid eye movement sleep. So from stage 1 to stage 4, it's non-rapid eye movement sleep, and here rapid eye movement sleep. So in non-rapid eye movement sleep, the movement of the eyes will be, or else we can say the movement of the eyes will be neither nil, or else there will be no movement at all. But if we see rapid eye movement sleep, there will be excessive movement of the eyes. So here there will be rapid eye movement, and brain wave speed will be up and down. So the waves which are generated by the brain will be fluctuated. Because of the fluctuation, the dreaming will occur. So the dreams which are caused in the sleep are because of the waves which are generated in the brain, and that too they occur in the 5th stage of the sleep, that is rapid eye movement sleep. And here the muscles will be relaxed, and heart rate will be increased, and breathing is also rapid. This is the hypnogram. This is a graph which shows the sleep movements. So here if we see the awakening and REM sleep, stage 1, 2 and 3, 4 sleep. So here in the midnight we can see the person is undergoing stage 4 sleep, and that is like we can see this that sleep is persisting for little time, that is almost 1 to 2 hours, and there in during the period of 1:30 in the morning the person is undergoing the rapid eye movement sleep. So here we can see the fluctuations of the graph depending upon the time. Let us see what is insomnia. So insomnia is a condition where the person is unable to sleep. So the inability to sleep is called insomnia, and there will be difficulty in the person to sleep. So if a person even tries to sleep also, the person won't be able to sleep. And maintaining sleep throughout the right way, the person should maintain the sleep throughout. The sleep should be maintained in a proper manner. Here we can see what are the effects if the person is not having proper sleep. Any person, if the person is not having proper sleep, what are the effects we can observe? In shorter way, or else in other way, we can say that these are the symptoms of insomnia. So there will be irritability, and there will be impaired moral judgment. The person cannot judge what is right and wrong properly. Impaired immune system, and if the sleep deprivation it persists for longer period of time, it may even cause diabetes mellitus also. There will be increased heart rate, tremors, aches, that is body pains, hallucinations, etc. So there are various other effects if a person is not having proper sleep. Let us see what are hypnotics. So hypnotics are the drugs which induce sleep. We can say these are the drugs which even induce drowsiness. So that is the reason these are used in the treatment of insomnia. Or if a person is unable to sleep properly, these hypnotics are given to a patient in order to make them sleep. So these hypnotics act in such a way that they induce sleep which looks to the normal sleep. So they don't look like the person is taking the sedatives. So the sedatives and hypnotics are different. So sedatives cause deep sleep which don't look like the normal sleep. But if the person is taking hypnotics, it induces just a drowsiness. So that the discomfort which is caused for a person to be awakened, that will be prevented, and thereby the person can sleep properly. These hypnotics are used to treat anxiety for longer period of time. So let us see what are the causes of anxiety. So there are various medical causes, like if a person is having any respiratory problems, endocrine, cardiovascular, metabolic and neurological problems. So if there are any disturbances in these systems, then that leads to anxiety. There are various other drugs which causes anxiety. In the sense that anxiety may be the side effect of various drugs. For example, stimulants like amphetamine, cocaine, tricyclic antidepressants, as well as caffeine. So these are the drugs which are used. For example, if we see caffeine, so caffeine acts by a mechanism where the brain stimulation is taking place, thereby where the person is getting awakened and the person will be in an anxiety state. So these drugs, if they are used for longer period of time, then definitely they cause anxiety. And there are the sympathomimetic drugs, that is adrenergic agonist drugs like ephedrine, epinephrine, pseudoephedrine, as well as phenylpropranolol. And there are anticholinergics or antihistaminergic drugs like trihexyphenidyl and benztropine, meperidine, diphenhydramine and oxybutynin. So these are all the drugs which causes anxiety if they are given in larger doses. Dopaminergic drugs like amantadine, bromocriptine, L-dopa, as well L-dopa is also called as levodopa. And there are other drugs like baclofen, cycloserine, and hallucinogens and indomethacin. So these are all the drugs which are causing they are having the side effect of anxiety. There are few drugs which causes anxiety on withdrawal. For suppose if a person is taking benzodiazepines, so these benzodiazepines therapy is given, and the drug should not be withdrawn all of a sudden. So the person should not stop the drug all of a sudden. For suppose initially the person is given a dose of 250 mg of benzodiazepine. So slowly the dose have to be reduced and the usage of the benzodiazepine should be stopped. But here if we withdraw this drug all of a sudden, then also that these benzodiazepines are used to treat anxiety. But if we stop all of a sudden, there may be a reoccurrence of anxiety. So there are drugs like narcotics, barbiturates, benzodiazepines, sedatives and alcohol. So these should not be withdrawn all of a sudden. If that is done, then withdrawal syndromes can be observed. Let us see the classification of hypnotics. So the drugs which come under this category are benzodiazepines, barbiturates and newer non-sedative benzodiazepines. So these are the main classes of drugs which are used to treat anxiety or which are used as hypnotics. So in barbiturates we can see they are short acting, intermediate acting and long acting. Even in benzodiazepines also there are short acting drugs, long acting drugs and intermediate acting drugs. And these are newer sedative benzodiazepines. So here normally these benzodiazepines on long term use they have a side effect of sedation. But these newer drugs like zaleplone, zolpidem and zopiclone, these are the drugs which are non-sedative but they show the mechanism of action or pharmacological effects similar to that of benzodiazepines. Apart from these three classes, there are various other drugs which show these hypnotic action as a side effect. In the sense, these three are mainly formulated marketed preparations, but here beta blockers, antipsychotics, antidepressants and antihistamines on long-term usage, they show the action of hypnotics. Let us see the first category of drugs, that is barbiturates. So based on the duration of action, how the drug is acting, these are classified as long acting, short acting and ultra short acting drugs. So here long acting drugs are phenobarbital, mesobarbital, short acting drugs are butobarbital, secobarbital and pentobarbital, and ultra short acting drugs are thiopentanone, methotrexate and hexobarbital. So these are also hexobarbital, these type of drugs are also called as hexobarbital, secobarbital, phenobarbital. So the name is altered, just it's an alternative name for all these drugs. So let us see the characteristic features of the drugs. So these drugs are here. These benzodiazepines are the other class of drugs which are replaced by the barbiturates. Why these barbiturates are replaced by benzodiazepines? So the various other reasons in order to replace this. So for example, the reasons may be induce intolerance. So barbiturates on long-term uses they cause tolerance. So that is the reason these barbiturates are replaced by benzodiazepines, and they cause drug metabolizing enzymes. So what does this do? They increase the segregation of these drug metabolizing enzymes, whereby the metabolism of these drugs is rapid, and they cause a physical dependence and associated with severe withdrawal syndrome. So these barbiturates, when compared to benzodiazepines, they have higher withdrawal symptoms effects, and their ability to cause coma in toxic doses. So they causes coma if they are exceeding these doses than the normal levels. They cause tolerance. The same time they are associated with the more withdrawal symptoms and dependence and drug metabolizing enzymes. So these are all the various reasons why these barbiturates are replaced with benzodiazepines. Let us see the mechanism of action of these barbiturates. So these barbiturates mainly act at the site of GABA receptors, that is gamma aminobutyric acid receptors. So this is one of the neurotransmitter which is present in the body, and this GABA is used to suppress the anxiety. We can say it causes depression. So here if we see these barbiturates, they allow the entry of chloride into the GABA receptor. So in the GABA receptors, if the chloride ions is entering, then that causes that allows the GABA to bind to the GABA receptor. So there are various GABA receptors like GABA A, B, C receptors. So these GABA will bind to those receptors and exert its action. So because of the entry of this chloride, the GABA action can be enhanced or potentiated. So these barbiturates, they allow the entry of the chloride to enter into the GABA receptors, and at the same time they allow the GABA to bind to the GABA receptors. Let us see the pharmacological actions of these barbiturates. So first thing is that they reduce the anxiety. So as these are used against the anxiety, they potentiate the release of the GABA. So GABA is a neurotransmitter which causes depression. So that is the reason it is used in the reduction of anxiety and sedation and induction of the sleep. So if these hypnotics, when they are used on long term, then they cause sedation and they cause sleep, and they even show anti-convulsive effect. So if a person is having any convulsive stages or seizures, then that is it shows mild anti-convulsive effect. And in a respiratory depression, so these barbiturates, they are dose dependent. So the dose of these barbiturates should be monitored. Why? Because if the barbiturates exceed their dose, it causes toxic effects, and if the dose is reduced, then there will be no effect. So even because of the higher levels of barbiturates, it may cause respiratory depression also, and sometimes it may cause cardiovascular depression, heart failure, and other diseases which are related with the cardiovascular system. But here, if these barbiturates, if they are given through IV route, then marked effects are shown in the respiratory system as well as cardiovascular system. What are the clinical uses of these barbiturates? So these barbiturates are mainly used along with anesthesia. They are used in anticonvulsant, and they are used to treat anxiety and hypnosis. These drugs on long-term uses, they cause tolerance. So how does this tolerance can be observed? So one thing is that they causes metabolic tolerance. So the drug, once entering into the body, it has to undergo metabolic reactions. So if this drug is administered on long-term usage, or if this drug is administered for long-term, then these drug, it shows resistance towards the metabolic enzymes, and thereby the metabolism of the drug won't take place. So if the drug is not metabolized, it is not excreted, as well as it is not even forming active metabolite in order to show its effects. So it shows metabolic tolerance. And if the drug is withdrawal all of a sudden, if we stop consuming this or else if we stop taking these barbiturates all of a sudden, then it may cause symptoms like tremors, anxiety, weakness, restlessness, as well as nausea and vomiting, seizures, cardiac arrest. So these are all the symptoms which are observed on withdrawal of these drugs all of a sudden. And if this withdrawal is much more severe, if these symptoms are much more severe, then it may also lead to death of a person. And that is the reason, if after the withdrawal of these drugs, opioids are not to be recommended. Let us see the adverse effects of these barbiturates. So they mainly cause adverse effects in CNS system. So in the CNS system, on long-term usage, they cause drowsiness. So because on excessive dose of this drug, they induce more sleep, causing drowsiness. There will be impaired concentration. The person cannot concentrate properly, and at the same time, there will be mental and physical disturbances in the person. And on very long-term usage, it may cause poisoning also. So barbiturate poisoning can lead to respiratory depression as well as cardiovascular depression. So on long-term usage, they completely suppress the activity of the respiratory system as well as cardiac system, leading to the coma and death of the person. And these barbiturates, they increase the porphyrin synthesis, and that is the reason they are used in acute intermittent porphyria. So what is this porphyrins? So porphyrins are the group of compounds which are present in the hemoglobin. So if you see the structure of hemoglobin, hemoglobin. In the hemoglobin, we can see porphyrin groups. So these porphyrin groups, what does they do? They carry the oxygen in the body. So we usually say red blood cells carry the oxygen. So these red blood cells contain hemoglobin, and in the hemoglobin, the porphyrin structure, it binds to the oxygen, and thereby it is carrying the oxygen throughout the body. So if these porphyrins are absent, then the oxygen transport will not take place. So barbiturates, what does they do? They increase these porphyrin synthesis, and thereby the oxygen that can be properly supplied. So that is the reason they are used to treat in acute intermittent porphyria condition. So what are the drug interactions? So or else we can say, what are the contraindications of these barbiturates? So there are pharmacodynamic interactions as well as pharmacokinetic interactions. So what are these pharmacodynamic interactions? So these barbiturates should not be given with CNS depressants like tricyclic antidepressants and MAO inhibitors. There are various other antidepressants. So these barbiturates should not be given with these drugs because they may cause the CNS depression. So these barbiturates, they induce sleep, and at the same time CNS depressants also, they cause drowsiness. They suppress the action of the CNS, thereby the action is potentiated or it shows synergistic effect. And in PK interactions, that's pharmacokinetic interactions, these barbiturates, they induce hepatocytochrome P450. So there's a protein which is involved in the various metabolic reactions. For example, the drugs like dicumarol, phenytoin, digitalis compounds, and grisofulvin. So these are the drugs, we can say, these barbiturates, they induce the cytochrome P450, whereby they undergo metabolism. These drugs like dicumarol and all, they undergo rapid metabolism by this cytochrome P450. So that is the reason they causes the interactions with these drugs. The other class of drug is benzodiazepines. So the various drugs which come under this category are diazepam, flurazepam, nitrazepam, flunitrazepam, temazepam, triazolam, and midazolam. There are newer non-sedative benzodiazepines like zaleplone, zopiclone, and zolpidem. So they differ from other class of benzodiazepines in the sedative effects. So these don't cause any sedation. So here let us see the other class of drugs, that is benzodiazepines. So benzodiazepines are, we can say, these are the most frequently used drugs, or these are the most marketed drugs in the these are the most marketed formulations. So they produce tranquilizing effect, in the sense they induce sleep in a persons, and these benzodiazepines are replaced with barbiturates because of the various adverse effects of these barbiturates. And these benzodiazepines, they mainly act by the mechanism of GABA receptors. So they aid in the GABA receptor, they aid in the binding of the GABA to the GABA receptors and exerts its actions. And there are the various effects which are shown by these benzodiazepines are sedation, hypnosis, anxiety, muscle relaxation, anterograde amnesia. So this is a kind of amnesia where the person has inability to recognize, or else because the person has inability to memorize the things after the state of amnesia. So if a person comes out of the state of amnesia, then he won't have the ability to memorize the things. So that is anterograde amnesia and anticonvulsant activity. Let us see the mechanism of action of these benzodiazepines. So these are GABA receptors. There are 5 different units in the GABA receptors: alpha, beta, gamma, as well as delta. But there are 2 subunits of these beta receptors. So here the benzodiazepines, they bind to the GABA receptors, especially at the delta subunit of the GABA receptors. So when they bind to the delta, these delta subunits, they contain GABA A receptors. So here when these bind, they allow the chloride to enter into the GABA receptors, and thereby they aid in the GABA to bind to the GABA receptors and exert the action. Here we can see the benzodiazepines, like even the benzodiazepines as well as zolpidem and zopiclone. What does they do? They bind at the benzodiazepine site. So these GABA receptors have different sites. So one is benzodiazepine site, barbiturate site, as well as various other sites. So these benzodiazepine site, these benzodiazepines, they go and bind to the delta subunit of the benzodiazepine site, and thereby the chloride entry is taking place inside the GABA receptor. Here these are the various subunits of the GABA receptor, and here we can see the benzodiazepine site as well as GABA site. So GABA site is a place where GABA binds, and benzodiazepines is a place where benzodiazepines bind. So if the benzodiazepines bind, the GABA subunit gets opened, the GABA receptor gets opened, and calcium entry is taking place into the cell. Let us see the pharmacokinetics of these drugs. So these drugs are clinically very effective, and based on the duration of these actions, these benzodiazepines are classified into short acting, medium or intermediate acting, and long acting. So the short acting drugs are they exert their actions within 3 to 8 hours of administration. Drugs which come under this category are oxazepam and triazolam. And intermediate or medium acting drugs, they exert their actions within 6 to 24 hours, and the drugs which include are alprazolam, lorazolam, estazolam, and temazepam. And the long acting drugs which show their actions for almost 1 to 3 days are chlorozepate, diazepam, chlorodiazepoxide, and flurazepam and quazepam. Let us see the pharmacokinetics of these drugs. So these benzodiazepines, they undergo metabolism by a process called dealkylation. So this is one of the phase 1 as well as phase 2 conjugation metabolic reactions. So there are various biotransformation reactions which are undergoing in the body. So one of the biotransformation reactions are dealkylation and conjugation. So dealkylation is phase 1 reaction, as well as conjugation is phase 2 metabolic reactions. So these drugs have the long acting benzodiazepines have the long acting benzodiazepines, they undergo metabolism in the liver, thereby they form active metabolites. So as they stay in the body for a longer period of time, when the active metabolite is formed, then it exerts its actions for a longer period of time. And the T half of this flurazepam is almost for 2 hours. But if the actual drug T half is 2 hours, but if this flurazepam is converted into its active metabolite, that is N-des-alkyl flurazepam, its T half is almost for 50 hours. So there is a large variation in the T half based on the active metabolite. So if this flurazepam is not converted to active metabolite, then definitely it does not exert its actions for longer period of time. And the short acting drugs, they directly undergo a process of conjugation reaction with the help of an enzyme called glucuronide. So this glucuronide is a compound where it is involved in the process of conjugation. So the drugs like oxazepam, they undergo this conjugation type of process. So whereas the long acting and medium acting drugs, they undergo dealkylation process. Let us see the pharmacological effects. So what are the various pharmacological effects? So if these benzodiazepines, if they bind to once they enter into the body, they exert the actions like they reduce the anxiety, as well as they cause sedation and induction of sleep. So if they are used for longer period of time, they are used even as a sedation, or they cause sedation, and they decrease the muscle activity. So the coordination or the contraction and relaxation or the muscle tone can be reduced by these benzodiazepines. They are used as anticonvulsant, and they are used to induce even anterograde amnesia. Let us see the clinical uses of these benzodiazepines. So they are having various wide range of clinical uses, like they are used to treat anxiety, they are used to treat various sleep disorders, at the same time they are used to treat seizures and anesthesia and amnesia, alcohol and sedative hypnotic withdrawal. So if there is any withdrawal syndromes which are caused by the alcohol and sedative and hypnotics, these are used to treat them, muscle relaxations as well as psychiatric uses. Let us see the tolerance. So these also have tolerance and dependence. So these drugs, once if they are administered solely, then they cause the tolerance. So here they cause down regulation of brain benzodiazepine receptors. So what does this mean? So because of the excessive dose of the benzodiazepine, they causes saturation of the molecules. So here if the excessive benzodiazepine molecules are reaching the benzodiazepine site in the GABA receptor, then what does they do? They causes saturation, and thereby the benzodiazepines won't bind to the benzodiazepine site, and thereby the action can be reduced. And increase in the dose may show symptomatic improvement or to promote sleep. So if they, for suppose if a person is taking 250 mg for longer period of time, so 250 mg dose have caused tolerance. So then we have to increase the dose of the dose to the person in order to show its effects to induce sleep. It even causes dependence. So if these benzodiazepines, they are given in high doses, it may cause dependence. So the person, what does the patient feel? If I take these benzodiazepine drugs, then only I'll get sleep. For example, if we take alprazolam. So if these alprazolam are used for longer period of time, then the patient may get addicted. The patient will depend on that in order to sleep. So he'll forget to sleep naturally. So they cause even dependence on higher doses. And withdrawal, if we stop all of a sudden taking these drugs, it may cause the symptoms like rebound insomnia and rebound anxiety. So if we stop these drugs, then these drugs are used to treat anxiety. But if we stop all of a sudden, then the anxiety can be reoccurred, as well as the insomnia condition, that is sleeplessness condition, can also be reoccurred. So benzodiazepines which are having longer half-lives show the effects like, for example, the drugs like flurazepam. So on withdrawal, they show physical symptoms. So person will become weak, fatigue, if the withdrawal symptoms, if we withdraw all of a sudden these drugs, and last number of days after discontinuation. So these symptoms after the withdrawal, these symptoms will last for longer period of time, and sometimes it may be difficult to get out of the person from that symptoms. And the benzodiazepines with shorter half-life, the drugs like triazolam, they induce, we can say they have very less marked withdrawal symptoms when compared to longer half-life drugs. Let us see the adverse effects of these benzodiazepines. So these are dose dependent. So these we have to administer. The dose of these drugs should be monitored while administration. So if the dose is exceeded, it causes CNS depression, and it even causes drowsiness, sedation, and because of the excessive sedation, and sometimes it may lead to coma and death, and it also leads to ataxia. So ataxia is a condition where the body movements cannot be, body movements are improper. So the person's body movements are not controlled by the brain. So that will be impaired, and confusion, there will be memory loss, and there will be fatal toxic occurrences are very rare. So death is very rare. So if they are used in very high doses and they are used for longer period of time, then only the person will go to coma and death. What are the drug interactions? So these drugs are also having pharmacodynamic as well as pharmacokinetic interactions. So these benzodiazepines, if they are administered with CNS depressants, they cause additive effect. So these benzodiazepines, they suppress the CNS activity, and if CNS depressants are given, it shows synergistic effect. And here in the pharmacokinetic interactions, the cytochrome 450, here the cytochrome 3A4. So there are various cytochrome enzymes. So cytochrome P450 enzymes are there, and here one of the enzymes like cytochrome P3A4. So cytochrome P3A4 inhibitors should not be given with benzodiazepines. Why? Because they cause the prolongation of action of these benzodiazepines. So they allow the benzodiazepines to exert their action for longer period of time. So in that case, it may cause adverse effects. And these cytochrome P3A4 inducers also should not be given benzodiazepines, because they can reduce the therapeutic effect of benzodiazepines. Even they will reduce the normal effect which is shown by the benzodiazepines. There are other sedative hypnotic agents like buspirone. So buspirone is a 5-HT1A receptor antagonist. So these are serotonin receptors, 5-hydroxytryptamine receptors. So there are 5-HT1, 2, 3, 4 and 5 receptors. In 5-HT1 also we have 5-HT1A and 5-HT1B. So especially to 5-HT1A, the buspirone is one of the antagonists. Buspirone is one of the partial agonist of 5-HT1A receptor. And in therapeutic doses, if we give this buspirone in therapeutic doses, it will not have any sedative effect or anticonvulsant effect like when compared to benzodiazepines and barbiturates. So even they are administered in therapeutic doses, they show sedation effect, they show anticonvulsant effects. But here this buspirone, if it exceeds its dose, then only these sedation and anticonvulsant activities are observed. And there will be no withdrawal symptoms. So if we withdraw this buspirone all of a sudden, then also there will be no withdrawal symptoms observed. But here the one disadvantage is that it has slow onset of action. So once it's administered into the body, it does not show its actions immediately. It will take some time to show its actions. Here the frequency of adverse drug reactions, adverse drug effects is very low. So here the buspirone, if it is given in higher doses, then only it shows its adverse effects. But the frequency of these adverse effects is altered, or else we can say it's very low. So if it exceeds its doses little also, then most adverse effects are not observed. But there are common side effects like headache, dizziness and nervousness. But if they are exceeding their dose than the normal level, it may cause BP. So here the blood pressure can be observed, or the blood pressure can be observed if a person is receiving buspirone with MAO inhibitors. So MAO inhibitors are used as antidepressant drugs. So MAO inhibitors should not be given with buspirone because it may increase the blood pressure. The other drug is Ramelton. So Ramelton is one of the drug which is used as a hypnotic, and this is a selective MT1 and MT2 agonist. So these are melatonin receptors which are present in the body, and these bind to the MT1 and MT2 receptors. And this is used in the treatment of insomnia. So it's not having much pharmacological actions. The only action is to induce sleep or to treat insomnia. The rare adverse drug reactions, the rare side effects of these drugs is dizziness, fatigue, as well as decreases in the testosterone levels. So if they are given in higher doses, the testosterone levels in men can be reduced, and at the same time they increase the levels of prolactin in the women.